overflow in the biliary system can damage one or more organs in the system. This obstruction can lead to infections and inflammation in the bile ducts, pancreas, or liver. If the condition is left untreated or becomes more severe, it can be life-threatening.
Complication of gallstone occurs when the blockage of the biliary duct was not relieved, and then if let's say the blockage occurs at the neck of the gallbladder, so then it's not relieved, and because of then the gallbladder get infection. When they say infection, we call that as acute cholecystitis.
The infection can be very serious and even formation of pus, and this can lead to a severe infection or sepsis.
If this is not treated immediately, it will go into a condition called gallbladder empyema, where the gallbladder has become filled with pus, and this is already a medical emergency.
Sometimes it delay diagnosis and also delay treatment of the cholecystitis. The sac of the gallbladder can also rupture, and the bile juice or the pus can leak into the abdomen, causing a severe infection of the abdomen.
Most gallstones are called silent stones because they do not affect the function of the gallbladder, liver, or pancreas, and thus do not cause symptoms in individuals who have them. However, if a gallstone obstructs bile flow within the biliary system, it can damage the involved organs. Potential complications include inflammation of the gallbladder, cholecystitis, inflammation of the pancreas, pancreatitis, inflammation of the liver, hepatitis, infection of the bile ducts, cholangitis, bloodstream infection, septicemia. If left untreated or if the condition worsens, these complications can become life-threatening.
Patient with the gallstone with pain come to the doctor. Of course, the doctor will go through the normal procedure like history taking, talking about typical type of pain due to the gallbladder. Subsequently, the doctor will do a physical examination to examine if, for example, there is an infection of the gallbladder. When we press at the upper abdomen at the right side, there will be severe pain as well.
A few tests that we will usually do is, first of all, your blood test. Your blood test, we do full blood count to make sure you do not have an infection or you do not have any underlying blood disorder. Your liver function test is to check, make sure that there is no signs of liver blockage or liver injury that concurrent occurs during gallstone. Okay, but the most common investigation that we do to diagnose gallstone is an ultrasound.
To see the stone either in the gallbladder or in the bile duct. Sometimes we also need a further imaging, for example, computed tomography scan, the CT scan, or even the magnetic resonance imaging, the MRI scan of the abdomen, to see or to confirm the existence of the gallstones.
Then, if we found that it's gallstone in the common bile duct, there are other steps that we can do is investigation called ERCP. This is a procedure where we use endoscope to enter your bile duct system, and by combination of fluoroscopy to have a picture of your bile duct to see whether there is stones inside your common bile duct.
In addition to a physical examination, several diagnostic tests are recommended for gallstones, including blood tests to detect infections and inflammation, urine tests to check for any abnormal substances and to rule out kidney infections, a CT scan, computed tomography to obtain clear, detailed images of the body, including the gallbladder, endoscopic ultrasound, a minimally invasive procedure offering a more detailed view of gallstones that may not be visible through other imaging methods.
Gallstones attack symptoms can mimic other health issues. issues such as gastritis, heart attack, appendicitis, and even stomach ulcers. So, it is crucial for you to get your licensed doctor to get the right diagnosis and treatment for your smooth sailing recovery.
If you have an asymptomatic gallstone, we do not need any treatment. Okay, the doctor will advise you to have a healthy diet, a diet high in fiber, eat less fatty food, and try to have a healthy lifestyle, lost weight with a slow pace. This is what you need to do for patients who have gallstone and they are without symptoms.
However, if the stone is causing problem in the bowel ducts, causing obstruction, a specific procedure called endoscopic retrograde cholangiopangarography (ERCP) is required to remove the stone through the bowel ducts by inserting a scope in the duodenum.
Small gallstones usually do not require treatment. Instead, doctors often recommend drinking plenty of water to help flush the stones out through urine. Pain relievers can help alleviate discomfort during the process of passing the stones. For larger stones, extracorporeal shockwave lithotripsy, ESWL, may be recommended to break them into smaller fragments, which will then be expelled through urine in the coming days. If the stones are particularly difficult to break, surgery to remove the gallbladder, cholecystectomy, may be the next step.
Gallbladder is an organ. Okay, if we remove that organ, are we able to live as a normal person? The answer is yes. You can live without a gallbladder. Okay, especially when the gallbladder is diseased, you need to remove it.
And after removal of the gallbladder, of course, we lack of the reservoir to store the bowels, so the bowel will drip continuously into the duodenum. Sometime at early stage after the surgery, people may encounter discomfort, indigestion, and also diarrhea.
But usually your body will adjust into it. After actually a few weeks to a few months, you will go back to normal.
So we always know that the bowel helps to digest off the fats. So definitely limiting high fat food. For example, fast food. We know that usually it's very high in fat content, and also red meat, processed meat also helps with reduce the recurrence of gallstones, and also cutting back on simple sugar is a very important point. If you are overweight or if you are obese, losing some pound definitely helps to reduce the occurrence of gallstones.
Start low, go slow, and let your body adapt. And you must always listen to your body. Your body will tell you what you can and cannot do. If you're too tired excessively, that's something wrong. Your body is not ready. Drink lots of water, prepare your body, listen to your body. Learn how to listen to your body to know what your limitations are.
In addition to maintaining a healthy and balanced diet, regular physical activity is key to reducing the risk of gallstone formation. Endocrinology experts recommend the following activities: brisk walking or walking at a moderate pace for at least 2 to 3 times a week. Low-impact exercises like swimming to relieve abdominal stress. Cycling, a highly effective activity to enhance blood circulation and digestion. Aerobic exercises, which are especially beneficial for promoting better digestive health, particularly after bile removal.
Balik dia bagi ubat je. Ubat urea tu untuk apa? Lawatkan kencing kan. Minum ubat tu keluar dia punya batu tu hancur kan. Sakit lah sakit, cuma dia rasa macam ada benda nak keluar kan. Lepas tu dia keluar ketul kan.
Obesity is a primary risk factor for gallstones, particularly among women. Therefore, it is crucial to cultivate awareness about the importance of leading a healthy lifestyle within ourselves and our loved ones.
A healthy body nurtures a healthy mind. I'm Dr. Lisa Nabila, and thank you for watching My Body, My Life.